everyone, I am Dr. Archana from NICU Child Trust Hospital, Chennai. Here is a short video for all the new mothers out there. This is to sort your queries on breastfeeding. So, early initiation of breastfeeding is very important. Early initiation of breastfeeding is giving your baby breastfeed within 1 hour of delivery. It is important that all babies are fed colostrum. Colostrum is the breast milk that initially comes to the mother. It is yellow in color and it is rich in antibodies. There is a myth that the colostrum should not be given, but it is not true. All babies should definitely be given colostrum. Exclusive breastfeeding is giving your baby only breast milk till 6 months of life. Baby should not be given water, no honey. Any medicines that are prescribed by the practitioners can be given. It is important to continue breastfeeding till 2 years of age. So why should breastfeeding be given? When breastfeeding has a lot of benefits both for the mother and for the baby. Coming to the benefits for the mother, it helps in postpartum weight loss, it acts as a postpartum contraceptive, and it also reduces the risk of breast and ovarian cancer. Breastfeeding also has a lot of benefits for the baby. It improves your baby's brain development. It helps in providing immunity for your baby. Proper positioning and attachment during breastfeeding is very important to have a smooth breastfeeding journey. Coming to positioning, it is very important that the mother should be comfortable while breastfeeding. Mother should be comfortably seated with her back well rested while feeding the baby. The baby should be comfortably placed against the mother's arms with the baby's head and body well supported. There are few signs of attachment that have to be followed. Baby should not be sucking just at the nipple of the mother. That will cause pain to the mother and it will also increase the risk of nipple sores for the mother. So while breastfeeding, it is important to make sure that the baby's mouth is wide open. The lower lip of the baby should be everted. The chin of the baby should be touching the mother's breast. The areola is the dark part of the mother's breast surrounding the nipple. It is important that most of the areola is visible above the baby's upper lip and below the lower lip of the baby. So how will you know that the baby's breastfeeding intake is adequate? Post breastfeeding, a baby will be sleeping for around 1.5 to 2 hours if the feeding is adequate, and a baby will be passing urine around 6 to 8 times per day. The WHO theme for this year says enabling breastfeeding for working parents. So even if you're a working mom, it doesn't mean that exclusive breastfeeding cannot be practiced. Just because you're a working mother, it does not hinder you or doesn't stop you from practicing exclusive breastfeeding. Even if you're a working mother, you can breastfeed your baby in the morning, and express breast milk can be stored by you in the morning and it can be fed to the baby throughout the day. So if you're expressing your breast milk, it can be stored in the room temperature for around 3 to 4 hours. If you're storing it in a refrigerator, if you're storing it in the coolant region of the refrigerator lower down, it can be stored for around 3 to 4 days. And if you're storing it in the freezer region, it can be stored even for 1 month. Hope this video helps all the new mothers and the mothers to be out there. So let's enable all mothers to practice exclusive breastfeeding. Thank you.